you were born after 1955, the mention of polio probably doesn't scare you, and with good reason. That's the year scientists effectively banished the disease by discovering a vaccine. But not before it crippled or killed thousands of once healthy children and adults. The cure came through ordinary Americans who wanted to stamp out polio. They accomplished it with thousands of small donations in support of research to find a vaccine. That story has been replicated again and again through a mix of public investment, private philanthropy, and basic science. Together, Americans have unleashed cures for many life-threatening and chronic pediatric conditions over the past several decades. At the Herman B Wells Center for Pediatric Research, our daily life revolves around asking and answering today's scientific questions to stem a relentless tide of diseases that affect children.
The Wells Center for Pediatric Research is a place where all of the basic science studies that are done in the Department of Pediatrics are completed here. So we have 41 investigators and close to 300 students, technicians, scientists, and fellows that all participate in those basic science projects.
Wells Center's major goal is to find new cures for rare pediatric diseases. Most often, large pharmaceutical companies try not to touch small populations of patients who have rare diseases because the profit margin is not large enough. And to a parent who brings in a child who has a rare disease, for them, it really doesn't matter whether it's rare or not, they want a cure.
The Wells Center plays a major role in dramatic improvements for children's health as one of the nation's leading sites for pediatric healthcare research.
About 80% of the research in the United States is done in less than 20 departments of pediatrics. We're routinely in that mix and are currently ranked number 6 in NIH-supported research of all public institutions.
Every day, our scientists are unraveling secrets to the role of genes, lifestyle, and environment to illness, chipping away at new treatments and public health practices to end diabetes, autoimmune diseases, cancer, congenital heart disease, asthma, premature births, HIV, and other diseases that come at such a great cost to mankind.
So all of these research areas are very tightly intertwined with the clinical folks who see the patients on a regular basis. And then we interact with these physicians to see how we can devise newer and better strategies to treat our pediatric population.
Working with their peers around the globe, supported by people who understand the importance of pediatric medical research, some scientists at the Wells Center will spend a lifetime uncovering clues that bring us better understanding.
A lot of times our results will point to like, oh, there's a drug out there and maybe that drug could be used in these patients, and then start talking to other people involved in the disease, like around the country and around the world, and try to get input from that, and that's what you get really kind of fired up.
With so many cures behind us and so many families hoping for new science to give their children a chance at a better life, it is easy to see why each generation must respond to the health challenges of their era.
Whatever trajectory my own career takes, I know that there's this next generation of physicians, of students, of PhDs coming along that are committed to making a difference, and they're really smart and they're really engaging, and they are going to make a difference.
The childhood diseases of the 30s, 40s, and 50s are gone, but children keep coming to Riley at IU Health. We still need new knowledge to keep the healthiest children well all through life.
What we're doing here in the basic research labs are trying to come up with new ideas, new approaches to solve problems for which there currently are no answers.
Much like Americans climbed on board with researchers to find a cure for polio, a new generation of forward-thinking high school and college students are raising millions of dollars for pediatric research in dance marathons around the state.
I started at Purdue University and I really became inspired by the Purdue University Dance Marathon. And at the time, we were raising around $100,000. And by the time when I left, we were raising over $500,000 and raised over $1 million that following year. So it's been such a great experience to work at supporting Riley, but now to be at the Wells Center and doing research, supporting the same organization from a different perspective has been just an exciting development.
Compassionate Hoosiers see how their contributions to the Riley Children's Foundation can make a difference in the world.
The philanthropic support we get here is a major draw because we are able to draw upon those funds to start off projects that may lead to us eventually getting grants from places like the NIH, and also to do smaller projects that maybe wouldn't be eligible for NIH funding but that are important to the kids we see.
To keep moving forward, we need everyone's support for pediatric research at institutions like Riley at IU Health and the Herman B Wells Center for Pediatric Research.
It's clear that a lot of nuts are going to get cracked, that we're going to be able to treat a lot of things now that can't be treated. Just in the kind of very focused field that I've been working on for about 28, 29 years now, the progress has been tremendous. If some of the newer findings hold up, we're going to be able to deal with a lot of diseases now, both in pediatrics and in adults that years ago we couldn't touch.
We invite you to visit the Wells Center website to learn how your support changes healthcare for children in Indiana and throughout the world. Visit us at wellscenter.iupui.edu.